Good afternoon, everyone. Welcome to today's press conference for Friday, the 27th of November. Welcome. Today on the panel, we have Lucy Whiteman, our Director of Public Health, Eileen Doyle, Chief Executive of Kettering General Hospital NHS Trust. We have Simon Blatchley, Assistant Chief Constable, Northamptonshire Police. We have Becky Bradshaw, who's the Director of Estates and Campus Services at the University of Northampton. And we have various councillors and other colleagues who have joined us on the call as well. The running order today will be Lucy, and then Eileen, then Simon, and then Becky, and then we'll come to the written questions that our friends in the press have kindly submitted to us. And then if we have some time at the end, we will come to subsequent questions. I will go straight away then to Lucy Whiteman, our Director of Public Health, to talk us through this week's figures. Thank you, Lucy.
Thank you, Councillor Morris, and good afternoon again, everybody. So as usual, we have produced our weekly surveillance report. So this is containing data up to the 22nd of November. Obviously, this is the first week, the first full week of data from the lockdown period, where we would start to expect to see the effects of lockdown start to play out, which indeed we have. The positive news is we have had a reduction compared to the previous week in our cases, but sadly it's not as rapid a reduction as we would have liked. And we've talked before about the fact that we had a really big spike in cases in the week coming up to lockdown because of people sort of going out and doing things before those new restrictions came into place. And I did talk about the fact we had a lot of ground to catch up on. And indeed, sadly, that is still the case. We're still not back even at our pre-lockdown levels. So good news in the fact that we're managing to start to bend that trend, but our reduction in cases is not as rapid as I would have hoped. So, we really have got to make sure that people understand the opportunity we've got with the last remaining few days of lockdown and how we've got to make the most of gaining some ground and getting us back into a better position as we come out of lockdown and into tier 2. So if we go down, please, to the first set of data. So obviously a reminder that we are still in the national lockdown. We still have to adhere to all of those restrictions until the 2nd of December, when we will emerge in tier 2. So the current position, as you can see, and the reason that we're coming out into tier 2 is we've still got a relatively high rate of cases compared to previous weeks and months. This last week up to the 22nd of November, recording 1,296 cases. So again, still seeing average daily figures that were the same as we were seeing in a whole week in September. If we go down to the next slide. We can see that the distribution between gender and age groups continues to push up that age range. So obviously affecting our more vulnerable age populations now on a sort of 3-week trend. Yes, we are still seeing cases in our younger age groups, and we will continue to do so, particularly obviously as they attend school, attend university, etc. But that real increase in the working age group, and particularly into the over 60s, is still a significant concern and is still translating into pretty much a week-on-week increase in the number of admissions that we're seeing, and sadly also the number of deaths. We've got a large number of patients, again larger than we've seen in recent weeks, in our acute settings, and I know that Eileen will be sharing some details about that. But you can see that female bias still playing out locally. But as I said, our concern is that key age group starting to really seriously be affected. We go down the slide, please. So that good news obviously starting to play out, as I said. So we are seeing a small reduction in the number of cases in each of our boroughs and districts, and therefore as a county as a whole. But, as I said, we're still a long way off being even in the place we were the week before we went into lockdown. So that is a real concern. If we look at the next slide, we can see the rates for each of the boroughs and districts. So again, you can see obviously that we're starting to bend that trend and see the slope of our increase starting to come down. But you can see quite clearly there, South Northants and Northampton are actually still, if not slightly above, the England rate. And you only have to go back, as you know, as we can see from this graph, to the end of October to see that we were way below that. So the rapid increase in cases here is what's causing the problem, and has meant that us bending that trend is just that little bit more delayed than we've seen in other areas in the country. You can see the Northamptonshire trends start to bend, which again is good news, but you can also see that Wellingborough case rate is actually still going up at the moment. So we've got to keep an eye on these areas and continue to really push those messages about making the most of lockdown and making sensible decisions when we come out. If we move on to the next slide, please. So here, as I've said, you know, really starkly illustrates that significant increase in the 60s, over 60s case rate, really pretty much as a pattern across all boroughs and districts, but a very stark and significant spike in Corby there and South Northants. Again, as I said, this is clearly translating into pressure in our NHS services. And we will just want to remind families that, you know, we know people have caring responsibilities, but if they do have to have contact with their older relatives for caring needs, for whatever else, that we just try and reduce our contact with everybody else so that we pose less of a risk to them as and when we do have to see them. You know, this is really quite a significant and I think stark picture here. And I'm sure Eileen will shed some more light on obviously the pressure and the, you know, the concerning outcomes that we're seeing in our older population in our hospitals too. The next slide, please. So the case rate here, obviously, as we've seen there, playing through to a statistically significantly higher rate of cases in both Northampton and South Northamptonshire compared to the county average. And in fact, now similar, as I said, to that of the England average. We know that we were significantly below across all of our boroughs and districts only a matter of weeks ago. So yes, good news in the fact that we're starting to move in the right direction, but we're just not getting the pace that I would have hoped during lockdown. The next slide. What we've tried to do here is include a little bit more granular detail from Paul about the situation within schools. And again, I'm sure he's happy to answer questions about this. But obviously, we continue to see outbreaks in the schools, and it will continue to be a feature, no matter how good the settings are. A lot of the activities outside of school are the cause of the continued transmission in the community. But you can see there trends from a point of view of absences, COVID-related absences for teachers, teaching assistants and children. And a percentage of schools either around their open status or the actual percentage of children attending. So yes, that has been affected in the last couple of weeks, more so the children attending. But the other thing that's worth noting here is that pupils are still learning online, and that isn't counted in the pupil attendance figures. That's about physical presence in the school building. We don't want people to think that 15% of our pupils are not actually accessing education. They are, just through other ways. This is about physical presence in a school. So if we go down again, please. If we go down to the outbreaks, obviously people know they can have a look at the areas that are most affected in any area in their own time. But at the point that this was produced, so again, remembering that this is data up to last week, we had 67 outbreaks that we were actively managing in the county. And again, you can see that spread across all of our boroughs and districts still, and all of our different settings. We had a small reduction in the number of workplace settings. Again, primarily you could start to see the effect of lockdown from a point of view of some of those settings obviously being closed, people working from home, and therefore transmission rates being reduced. And we'd had that sort of 14-day incubation period in the data, and therefore this was starting to demonstrate the impact of lockdown, at least within our workplaces. The good news is that we've seen outbreaks come down even further in the last week. So you'll see a much more positive picture in next week's data, I'm sure. If we go down to the next slide, please. So this will be the last one that I talk to today. So, you know, we've started to try and include our flu vaccination information, because this is one of the key messages that we need to get through to everybody in the county who is eligible for a flu vaccination. It's one of the key measures from a point of view of making sure that we maintain as much, you know, ability to deal with COVID in our system, and therefore making sure that our beds aren't taken up in our acute settings with flu patients is really, really key. The positive news is, compared to last year, we've got an increase in the uptake of flu in the over 65s. In the at-risk groups, in the under 65s, and in young children aged 2 to 3. But we've still got that lag in pregnant women taking up the flu vaccination. And we've got to remember, it's not just to the benefit of the pregnant lady, but also the baby, as they obviously have such a low immune system when they are actually born. So please, still encouraging everybody who is eligible to attend for their flu vaccination as soon as possible, particularly trying to get that out of the way before the COVID vaccination becomes available, but in particular making sure that we protect our pregnant women and obviously all the newborn babies over this winter period. So if I stop there, the one thing I did want to share, if that's okay, Councillor Morris, was something with regard to how we've been placed in Tier 2. And there is a publicly available document that, if I can, I would like to share, and that really starts to give people an idea. There are thresholds which are not definitive, we have now found out, because when they make decisions, they want to make sure in central government that they're taking in all of the context for that local area, not just the data. So what we have been provided with, and this is a freely available document, and I'm happy to give the press the link to it at the end, is this graph, which I think really, really helps us understand some of the key variables, not all of them, but a couple of the key variables and how they have contributed to the placement of different areas in different tiers. So you can see Northamptonshire here towards the sort of upper third of Tier 2. So clearly not at the very top of Tier 2. So we're not at immediate risk of going into Tier 3. As I said, this only plots some variables, so people need to understand there is a much broader context that is taken into consideration when decisions are being made. But we're clearly, a little way away from being in Tier 1. Now, we have got 3 areas off of the Chief Medical Officer's watch list before, and I am confident that the residents of Northamptonshire can step up to the challenge and they can see the benefits and the actions that they need to take to get us back down to Tier 1. But I thought this would just help provide some context, and just so people are aware, obviously, of the different things that this is plotting here. So the size of the spot is relative to your weekly case rate for your over 60s. So you can see we're pretty much between around 200, but that is a county average. So we do have areas that are under 200. Obviously yellow because we've been put in Tier 2. And obviously it gives us our overall case rate per 100,000 population for all ages. So again, you can see where we are relative to the other areas in the different tiers. So I thought that might be helpful to share with our press colleagues in order to help answer some of the questions about why we've been placed where we have been placed and what our ambition needs to be in order to step back down to Tier 1.
Thank you very much, as always, Lucy. Very interesting data, as always. I'm going to come next to Eileen Doyle, who's the Chief Executive of Kettering General Hospital NHS Trust. Eileen.
Thank you, Councillor Morris, and hello everybody this afternoon. Another busy week for both hospitals, both acute hospitals in our county, and I can see my screen is frozen, so hopefully you can hear me. Today, as we sit here, we have 171 patients who are COVID positive, who are inpatients in the 2 acute hospitals. By comparison, if we think back to last April when we hit our peak numbers, that's at around 247. So today we have 15% of our overall bed base taken up with patients with COVID, which is lower than we were anticipating, but nevertheless is higher than we would like it. So in terms of, we work on trajectories and seeing what's coming forward, we are expecting this week and next week to be our busiest weeks. But clearly the fact that the numbers have gone up, but not as dramatically as we thought they might, is testament to the residents of Northamptonshire and everything that people are doing in order to make sure that the spread of this virus is contained. We have 14 patients out of our 14 patients out of our 34 intensive care beds are COVID positive. So that represents about 41% of those beds available. We have level 3 intensive care beds available at both sites today. So level 3, for those of us who don't live and breathe this, are those beds for which we provide the highest intensity of care. And we have had the capacity on both sites actually for the duration of this pandemic so far. Some of the questions that have been coming forward is what happens, do we take patients from out of county? And just to explain how ITU works across the country, is that their ITU beds are such a precious resource. It's taken out of our hands really as hospitals, and so therefore we work in a critical care network, and that is run by clinicians, and they are in constant touch with each other about where patients are and what care they need and who's got available capacity. And that's not a COVID thing. That's been around for years and years, and it's a very fair, well-trodden route of how we manage intensive care beds. Because the worst possible thing is we've got somebody who is perhaps in a neighbouring county that's within our network that could potentially die if they don't get the care they need. That said, of the patients that we do have, the 27 patients that we have in our 34 available beds today, 4 are from out of county, but those are for other reasons other than COVID. We have 86 staff, so nearly 10,000 staff that we have between the two organisations. 86 are confirmed positive with COVID, and obviously we have a number who are shielding or self-isolating, and we monitor those colleagues very carefully. And clearly, from a shielding or extremely vulnerable category, all those staff members are working at home and have been for some time, so we have adapted. It's busy. We continue with doing other work. I think both myself and my colleague Debbie Needham from Northampton General have said on many of these briefings that we continue with other work, particularly around some of our cancer and urgent work. That hasn't stopped. Clearly, we have to keep a very close eye on managing the balance between the demands for COVID, the demands for winter, and the other demands that we see each day. But we are continuing to monitor that very, very carefully. And at the moment, things seem to be just about steady, so that's good. In terms of messaging, obviously tier 2, and we come out of lockdown next week, and that's my sincere hope that we kind of adhere to all the rules that we have been talking about for such a long time. And coming up to Christmas, it's really, really difficult, isn't it? We're all desperate to see our friends and family, but what we don't want to do is come back in January and be facing another peak. So our messages are the same as they always are from a hospital perspective. Please maintain your space, wear a mask, and wash your hands regularly. Thank you, Councillor Morris.
Thank you very much, as always, Eileen, and thank you for all the work that you and your colleagues are doing in both the hospitals. It really is very key work that's going on there, so thank you very much. Simon Blatchley, I'm going to bring in you next, sir. He's Assistant Chief Constable of Northamptonshire Police. Simon, good afternoon.
Good afternoon, thank you, Councillor. Good afternoon, everybody. Our role as policing, as been mentioned before, we really support the work being carried out by health and the councils, particularly on the enforcement front. I can but only echo the messages that have been given already about, our core role as policing is to keep people safe. Our support to that is our enforcement. We've continued to enforce over the last week with approximately 100 tickets issued, fixed penalty notices for a range of issues such as people gathering indoors in greater numbers, failing to wear face coverings on public transport, outdoor, and then unnecessary travel as well. There's been no particular incident or grouping. This has been county-wide. Our hope is, of course, that with the messaging that we're putting out as a partnership, people do follow the rules. We are being put into tier 2, which is positive. We wish to stay there. We don't wish to go up a tier. So we're doing everything we can to support our colleagues. Policing point of view, we're obviously putting plans in place when we do come out into tier 2, and we're also looking ahead to Christmas and New Year possibly. Nationally, the full results of police enforcement are going to be published on Monday for anybody who's particularly interested. That's about it for me, really. Thank you, Councillor.
Thank you very much, Simon, as always. And again, thank you for the brilliant work that you and your colleagues do throughout the county to help keep us safe. It really is good to know how hard you are working on our behalves, and thank you. I'm going to bring in now Becky Bradshaw from the University of Northamptonshire. Yes, Becky, hi.
Good afternoon, Councillor Morris and colleagues. I'll only take up a few moments of time. I know time is short, and we've had a number of colleagues on campus today to launch the asymptomatic test facility, which will go live next week anyway. But I do just want to say, honestly, that we're encouraged by the falling number of...
Sorry, I didn't mean to interrupt you, but the sound's very poor. Could you...
Is it?
Apologies, that's okay. I think
Is that okay?
Yes.
Is that any better?
Yeah.
A little bit closer.
Thank you.
Okay. So obviously we're encouraged by the falling number of cases here at the university, and really that is testament to the behaviour of our students and staff over the last few months. I'd like to say that we take all the credit. It really is the behaviour of our students, and I do just want to mention that. That said, there is still a need for them to continue to follow the rules clearly, and we are obviously encouraging that they continue to wash their hands, to wear a face covering, and to ensure that they maintain social distance. I just touched on at the beginning and the asymptomatic test, which launches on Monday. I just want to take this opportunity to encourage as many of our students as possible to come forward for that testing. It's really, really quick and easy, and so we've got it down to 4 minutes today, in and out. It will not take you very long. It's pain-free, maybe a little bit uncomfortable, certainly pain-free. And you even get some free tea and biscuits at the end of it. We really do want to encourage you to come forward. Once tested, you've got greater reassurance that you're not going to take the virus back home to your loved ones for the festive period. Especially now that we know that some households can mix over Christmas. We know that potentially means that you're going to have vulnerable people that are in those households, and we want you to make sure that you're not taking the virus back home to members of your family. By taking part in the test programme, students are supporting the local and national efforts and keeping their families safe. So again, I can't say enough just how much encouragement we want to give to come forward and get tested between 30th of November and 9th of December here at Waterside. Thank you.
Thank you very much, Becky. As always, we missed some of that, I think, due to the sound, but I'm sure we'll pick up on the messaging later. Thank you very much, Becky. So we're going to go to the questions from the press, and the first one that we have is from Ben Waldron from Northants Live. I do feel we may have answered both of those questions, but I'll give you the opportunity to ask another question if you wish to do so, Ben.
Yes, thank you. As you said, I think both of those have been mentioned there. If I could just ask Simon Blacksley from the police again. Obviously, he mentioned the 100 fixed penalty notices handed out this week. Just kind of how frustrating do you find kind of having to hand out these kind of fines to people who are just ignoring the rules? And kind of do you anticipate this to get any worse as we move towards the Christmas period?
Thank you for that. Yes. Over to you, Simon. Thank you.
Thank you. Not necessarily frustrates me. Part of our role as a police officer is to enforce the laws, the rules, the regulations the government imposes. It is part of our role. This is a primary importance to the country at the moment, the safety of everybody. I think we're going ahead and do it. Yes, it's a little frustrating in that the lockdown rules, I think, are fairly clear. I think there's been some excellent messaging coming from us and then shared by yourselves in the media across the county. So you would hope that the messaging was landing by now. You'll be aware that early on we were really trying to just engage, explain, encourage people, but we have reached that time now where we do have to enforce more just to make sure those messages land, and hopefully by putting these messages up, people will take note that the police will enforce if appropriate. Thank you.
Thank you very much, Simon, and thank you for those questions, Ben. I'm going to come now to Alistair Oak from the Northampton Chronicle and Echo. Alistair, good afternoon.
Good afternoon. Hello there. Can you hear us?
Yes, all good.
Sometimes my microphone's a bit funny. Thank you very much. I think this is a question for the gathered politicians we have on the call, and I hope Lucy will forgive me. I'm not doing this to speak over her or speak on her behalf, but I would like to speak to politicians that are here. The Chronicle ran a story this week basically detailing how Lucy found out, again, I don't want to speak for Lucy here, found out about which tier Northamptonshire was in through the postcode checker rather than a briefing from the government itself. I guess I'd like to invite the politicians on the call here to basically, should the government have had the courtesy to brief Lucy and Public Health Northamptonshire in advance about which tier we were in, rather than having Lucy go on the website, I feel like she should have had a briefing first. And I don't mean to say it's in Lucy's place or to talk over her. I hope she sees where I'm coming from. If she has something like to say on that, I'd be happy to hear that too. But yeah, I thought it was. I'd love to hear what the politicians have to say, really.
Thank you, Alistair. Well, I think first I'll give Lucy the chance to sort of explain what actually happened, and then I'll ask Jonathan perhaps to come in and sort of after that, if he wishes to. Lucy.
Yeah, thank you, Councillor Morris, and it's very nice of you to obviously ask the questions, because a lot of times I think we all get frustrated with the amount of information that's coming through, and sometimes perhaps a delay in it coming through to the right people. However, I do recognise that yes, that was obviously the route I initially was having to look for it. I did then get a briefing through quite quickly, so within half an hour of the announcement. Unfortunately, there had been an anticipated, in fact, we dialed into a briefing the night before, but sadly, COVID-0 hadn't been able to make all of the allocations in time, and therefore didn't want to share tiers with some areas and not all. So, I genuinely, although sometimes very frustrating, do recognise how quickly these things move, and therefore not everybody is able to be informed in the way that the government would want, and I'm sure obviously always have an ambition to do so in the most timely fashions, but I did get the information within the sort of half an hour of the announcement. So I just want to make sure that people do recognise that. They may have obviously caught me at a time where I was being interviewed live and also trying to find out the information live. So yeah, it did come through.
Thank you, Lucy. Jonathan, did you want to make a brief comment on that?
Well, happy to, Ian. Not necessarily much to add. We have indeed, even with Alistair, we've had discussions before around the information that people do know and what information isn't made public and so on. And it's a difficult one there. I know that on that occasion, we were able to point to the precise guidance that meant it was right not to share certain info, but it's difficult to get it right, isn't it? One thing we do know is that everybody got told at the same time. Like Lucy, we at the local councils then got government advice, government notification of exactly where everybody, everywhere in the country fitted. And of course, they faced criticism over leaks before, where information was sent out that caused people to rush out and have a splendid, jolly weekend, when in actual fact we were going forward into a lockdown. So there may have been something in that. I suppose the other thing about this one is we got time to prepare, haven't we? This is an announcement around what was going to happen, around about a week later. It wasn't something that was coming in sort of midnight that night. So we're all taking the time, including today, to get ready to interpret what it means and so on. So on this occasion, given those factors, I'm reasonably comfortable, I guess. But it's a difficult one to get right. Who knows what and when?
Thank you, Jonathan. As you say, it's a very fast-moving river of information, and sometimes people get it all at the same time and not necessarily ahead of time. So, Alistair, you did have a couple of other questions, but I feel that Eileen may have already answered the first part, and I think Lucy may have answered the second question.
Yes, thank you. We were going to ask comparing patients in now to how we were in April, so that's already been covered. Thank you. We were going to ask if it's possible for the percentage of tests coming back positive each week to be included as part of the data packs in the future, because that is one of the main factors for just deciding our rates, basically, and where we are as a county. I don't know if that sort of information is available for the future. What do you reckon?
Thank you, Alistair. Lucy will answer that, and she's nodding her head, so I'm assuming it is.
Yeah, it is. I can give you them verbally from today if it's helpful. But the range of positivity by borough and district, because we still look at the data by borough and district despite decisions now being made at a sort of a county level, are between 5.3 and 9.2% positivity. Corby's is 7.2, Daventry's is 5.3, East Northants is 5.6, Kettering's is 6.2, Northampton's is 7.8, South Northants is 9.2, and Wellingborough's is 6. So yeah, I'm happy to include that information in the pack going forwards.
Thank you very much, Lucy, and thank you, Alistair, for your good questions as always. I'm going to come on to Carly Roberts. Carly, you've got a question for Paul Andrews, I believe. Hi, Carly.
Hi, it's the other Carly, but I'm happy to ask the question if that's okay. Yeah, so just to Paul, really. with obviously Christmas coming up and the new tiers, is there any recommendations for schools closing earlier to stop the spread and stop possible isolation before Christmas Day?
Thank you for the question. Paul, I'll come to you. Thank you.
Thanks, Councillor Morris. Hi, Carly. Thank you for the question. I think in all of this, we've followed DfE and government guidance when it comes to schools. And the guidance, the Christmas guidance that come out is really, really clear on it. If you're interested, section 2.1, it says children should continue to go to school. And as we've followed guidance all the way through, I'm fairly certain that that's what we'll continue to do.
Thank you very much, Paul. A succinct answer. Thank you very much for that. And I think most people on this call would think that the schools should remain open as long as possible. I would have said, but I can't speak for everyone. But that would be my view. I'm going to come on to Neil Barber from ITV Anglia. Hi, Neil. Good afternoon.
Hi, Ian. Just a couple of questions. One for Lucy and one for Simon, if possible. Lucy, we know that there's lots of people who are still shielding and are still feeling vulnerable and scared. What would be your advice to them? And is there anywhere that they can go to get support that is currently available? And Simon, from December the 2nd, what are your plans? Do you have any plans in place to enforce the no households mixing rule? Because clearly at the moment, we see that most infections are coming from mixing households.
Thank you, Neil. I'll come to Lucy first, then Simon, in the order that you asked them. Lucy.
Yeah, thank you, Neil. So yes, shielding. So in the first lockdown, there was a large cohort of residents that were identified as needing to shield. And they were obviously notified through various routes, but were identified primarily as the kind of people who would usually be on a flu vaccination list. So people who were immunocompromised, people who had long-term conditions, etc. The guidance now is for a much smaller, what are called extremely clinically vulnerable residents. So from a point of view of the formal support, it is a much smaller group that we're supporting. But the community resilience cell that was stood up in the first instance to deal with that larger shielding population still exists and has remained throughout at Northamptonshire County Council. It works really, really closely with all of the boroughs and districts and is able to provide food packages. It's able to provide and arrange the delivery of pharmaceutical goods, and it also is able to provide befriending services, obviously over the phone and sort of virtually, obviously under the circumstances, so that anybody who is feeling vulnerable and alone is able to get support, but not just support from anybody, but support from somebody who is local, who understands what's available locally, is able to signpost to other services as well. So it's a really good service. It's accessible either through contacting your borough and district or indeed through the Northamptonshire County Council website. I personally also receive emails from residents, and I'm always happy to do so and forward them on to that exact team who do a brilliant job of supporting people who, for various reasons, either have been advised clinically to remain shielded or obviously for their own personal reasons, and I absolutely understand why as well, are very anxious about going out and therefore choose not to. We're willing to help everybody that we can.
Thank you very much, Lucy. Simon, did you want to take the second part of that question? Thank you.
Yes, Councillor, thank you. As really we've been doing all the way along throughout the pandemic, we rely on information coming in from either members of the public or our partners to let us know if there are potential breaches. Officers are deployed, and then they'll go to wherever and make an assessment, engage, explain, and then as officers in all UK police, and they have discretion whether to enforce and issue a ticket or not. So really, it's just one of the powers that we've been given. We are reliant on the public. Our inquiries come in by phone, partners. We've got single online home as well, coming into the control room. We will respond accordingly. Thank you.
Thank you very much, Simon, and thank you for those questions, Neil.
Sorry, could I just follow up on that? Simon, does that mean that if a neighbour sees someone going into someone else's house, they should call you?
That's up to the individuals. That is, we do get a number of calls, particularly in the first lockdown. We do get calls from neighbours phoning in. If people believe there are breaches, yes, they can call, be it online, or they can put a phone call into the control room.
Thank you very much. Thank you, Simon, and thank you, Neil, for those questions. Oh, am I muted? No, I'm unmuted. Okay, sorry, it said muted. Right, I'm going to move on. Thank you, Neil. To last but by no means least, of course, Laura Coffey from BBC Radio Northampton. Hi, Laura.
Hi, Councillor Morris. So I have a couple of questions because one of them, Lucy, thank you, you answered about with the scatter chart. But just on that, it shows obviously the dotted line, we're above that dotted line so on the scatter chart. So it shows that we have had our rates decrease in the last week. On the second page, it goes on to say that those areas that are decreasing could see themselves come out of tiers, but in the new year. Now, the government has stressed that they will be reviewing this every 2 weeks, and I think some people will be kind of holding out for that 16th of December and thinking perhaps there might be a change. Do you think that's unlikely?
Thank you very much, Laura. And I think Lucy can come in, but I might bring Jonathan in as well on that, because I think his view will be very well appreciated as always. Lucy, I'll start with you and then come to Jonathan. Thank you.
Thanks, and thanks, Laura. So now you've obviously got the document as well. It's worth noting that there are sort of 5 sort of domains or areas that they're looking at in relation to decision making. Obviously, the 2 that are plotted on that graph are 2 that are quantitatively measurable and therefore can be plotted on a graph. Some of the others, obviously less so. Percentage of positivity could be plotted on a graph, but it would just make that graph too complicated. But things like pressure on the NHS and the speed at which the increase or the decrease in cases of interest is happening, obviously is less objective and much more subjective. Particularly obviously when we have 2 small district general hospitals, for example, we don't have the capacity and the resilience perhaps in our NHS providers that, you know, large teaching hospitals have, and we've talked about that before, and that clearly is a factor that's taken into account that can't be plotted on a graph. So I don't think that people should be despondent. I've talked about the fact that there is an opportunity for us to move between tiers, and even if that might not be possible before Christmas, and who knows, we absolutely are going to be reviewed in a fortnight's time. What we do want to make sure that we do is get ourselves into the best possible position before the relaxation period, because that clearly will have an impact. We saw that just before lockdown. We saw a 54.3% increase in our cases because of behaviours in a 4 to 5 day period. So similarly, over Christmas, I think it's quite logical to expect a similar change in our case rate immediately after Christmas. And that's the point at which pressure on the NHS is the highest. That period just after Christmas and New Year is considerable for the NHS, and therefore we all need to take responsibility for our actions over the Christmas period and do absolutely what we can to make sure that if we stand a chance of stepping down and also protecting our NHS services, that we do everything we can to get ourselves into that more positive position. So I can't give you a definitive answer from a point of view of all we've been told is that it gets reviewed fortnightly. I fully expect any changes to be taken into consideration in 2 weeks' time. But either way, we've got to be able to prepare ourselves for what's going to be a very difficult period after Christmas and make sure that we put ourselves in as positive a position as possible.
Thank you very much, Lucy. Councillor Nunn, did you want to comment on that? You usually do in a good way. Thank you.
I mean, happy to. Obviously, I didn't know what tier we were going to be in and what the tiers would be. I thought the scatter graph there was incredibly helpful. As a part of that, in the run-up to the announcement, I wondered if we'd be tier 3, really. Because we're still in serious trouble, aren't we? And I think if there is one message, it's act like we are in tier 3. We've just coming towards the end of what we've called a lockdown. It's actually been a lot less severe in its restrictions than the previous lockdown. We have to be absolutely honest. If nobody had had contact with anybody in the last 4 weeks, the rate of cases would be plummeting. It is only because of a form of continued contact, isn't it? And that's fine. We have to keep our lives going, of course, don't we? But naturally, it's great that we're back more to England averages, but this is not a massive reduction by any shape or form. We're still way above what we've seen on average throughout most of this pandemic. So we're still in serious trouble. So I think the message from me is let's minimise the contact, let's keep washing the hands, let's keep acting like we're in tier 3. Bear in mind, to the north, most of our neighbours in Leicester, you've only got to go as far as Market Harbour and you're in tier 3. That's a short trip down the road. So it's right on our doorstep. It's still an important and a really dangerous thing here with us, but on our doorstep, it's even worse. So we just got to act like we're in tier 3 and keep pushing with all the precautions. I think that'd be my general view. Thanks.
Thank you very much, Jonathan. And I completely agree with that. I actually sit about 200 metres from the border with Warwickshire. So 200 yards away, they are in tier 3 and I am in tier 2 here in, and of course, the differences that can make even in a rural area where you've got a border literally running down the back of your garden. But we have to be aware of that and we have to act accordingly. And as you say, let's go as if we're in tier 3 and work backwards from there. I've now got Laura. I think that was the end of your questions. You can come back in a minute if you want. Carly, again, your hand is up. So I'm going to bring you in. Carly, hi.
Hi, I've got one for Eileen, if possible, please. Deborah spoke last week about some non-urgent and non-cancer outpatient treatments and appointments being postponed and cancelled at Northampton General. She also mentioned that, as you said earlier, if the peak is yet to come, some may still be cancelled and more may be cancelled. I just wanted to check back in with you and ask whether any more have been cancelled over the course of the last week, and if there are any other plans to cancel more.
Thank you very much. A very good question, Carly. Can you answer that, Eileen? I'm sure you can. Eileen.
I can. So as Debbie mentioned last week, for Northampton General, they did decide to take a small number of cases down during the course of this week. And the way that both hospitals have now approached it, but also KGH had approached it, is that we have booked cautiously. So we always book cautiously coming into winter anyway, because unfortunately, capacity pressures are not new to COVID. So the way forward is we are looking at it. We're having a forward look every couple of days. We don't want to cancel people, and at the moment things are stable, so we're not intending to take down great swathes of work. But I know for NGH this week, they did take a small number down, and all of those patients will be rebooked.
Thank you very much.
We keep an eye on it constantly.
Thank you. I'm sure you do. It's one of those things you have to keep your eyes on the figures. So thank you, Carly, for that question. Laura, your hand is up, I see again. I may have missed out one of your questions, and if I did, I apologise. Laura, back to you again.
Hi, yeah, it was actually just a couple of additional questions. One of them just going back to the 5 factors that the government considers. They've said that, and again, it was in that document that was forwarded, that was there's no rigid thresholds being set. How difficult and challenging is that if there aren't clear thresholds of how you can move between the tiers? And then I just have a question for any of the council leaders, I guess. We heard a lot from businesses this morning on our breakfast show, one in particular who has set up a crowdfunding page to try and get donations to help keep them survive until spring. What support is out there for businesses, and what would you say it's one of the kind of arguments that we're hearing from some of our Conservative MPs who we understand have been lobbying the government for us to be in tier 1. Obviously we're not, but that was their concern, was the economic impact on businesses. So what support is out there?
Thank you very much, Laura. So I'll come to Lucy first, and then I'll come to Jonathan, I think, for the second part of that question, if that's okay. So Lucy, over to you.
Thank you. Laura, you do make my job difficult sometimes answering some of these questions. I don't know if you can see my response, but you know, I sort of smiled to myself. It's really hard. You know, I think we talked before because we thought we were going to get, you know, sort of clear and definitive thresholds. And, you know, I talked about the fact that would make it easier for me to do my job, for Simon to do his, around, you know, policing. And for the public as well, just to understand where they are and how effective their actions are. And I appreciate absolutely why the government have had to obviously take into account some of those contextual factors that I talked about earlier. And as I said, they are not quantitative, they can't be measured, you can't plot them on a graph, and therefore it's difficult to put thresholds around them. But you know, it does make my job and everybody else's job who is involved in this really, really difficult. It means there is, you know, an element of subjectivity to any of the decision making. But you know, when we are talking about mental health, when we are talking about the economy, when we are talking about people's lives and how they interact and how they are able to see their relatives, you know, you can't always count things in numbers, and so perhaps it's right and proper that there is that softer balance that has to come into play. You know, I am a data person by background. I like clear, distinctive thresholds, a yes or no answer, that kind of binary management. But, you know, clearly life's not like that. So it does make it challenging. I can't lie. And I think anybody who says any different is fibbing, to be honest. But I do recognise why they've had to do it. And I think, you know, just seeing that scatter diagram, although there are not clear numbers, you know, above which you are tier 2 and below which you are tier 1, you at least do start to get a feel about the ballpark numbers that we need to be aiming for as a county. And, you know, I still do believe this is doable. We've done it before, and I believe we can do it again.
Thank you very much, Lucy. I'm going to bring in Jonathan now, if I may. Jonathan.
Yeah, thank you. Also, just lastly on that other point, I think you're right. We all like clearly definable criteria. We need to know where we've got to get to. The trouble is, it is more complex, isn't it? We might see our rates come down, but if our hospitals are overflowing, that's still a good reason, I would have said, to keep us in a higher tier. So I do get that there has to be a bit of subjectivity as well as the objectivity. The second part of the question there was about business support, and you know, hopefully people know that we as a council in Northampton, and it goes for all the others as well. I think all the local councils are close to their businesses, they value their businesses, they know how important they are, and I have regular engagement both through the Business Improvement District in Northampton and lots and lots of individual businesses. So they're absolutely vital. In terms of support, on all of our district websites, you'll see it on all 7, go on them and they'll be quite prominent there, advice for businesses. In terms of grants, so we've had the second lot of government grants, a good deal smaller than they were before. Previously, a lot of these initial grants were 10, 25,000. These are more like sort of 3,000, even for a relatively big business for that lockdown period. And I know that at Northampton, we've got a much smoother system. We had to really make it up as we went along on a brand new system before with businesses we held no data at all on before. We then had to verify that these were genuine businesses. We've got all that now, we've done it. So our system is now seeing applications come through and the majority of them being paid same day or within 24 hours on these small grants. But everything you can learn about business support and additional business support and so on is offered through the South East Midlands Local Enterprise Partnership, SEMLEP, as well. All that information you can access through our Northampton Borough Council website, and I'm sure you can at Wellingborough, Corby, Daventry and the others. What we've just got to do is get this thing out the way and then try and get the businesses open. We hope that people will be careful. We hope that people will support our local businesses in the run up to Christmas, but we hope that they'll do it safely because protecting people's jobs is really, really important. We won't be doing a lot of the other things in Northampton that we normally do. We won't have a big Christmas light switch on that 10,000 people came to last year, but we will be asking people to come in, support local businesses, maybe do it through click and collect, but do it safely. I think it's the most important thing. Thank you, Ian.
Ian, can I add something, please?
Yes, of course. Councillor Auger, who's the leader of the Daventry District Council. Richard.
Yeah, for businesses out there, I just today agreed emergency powers to sign off the additional restriction grants, discretionary tranche of money that's just come through. As Jonathan rightly said, those monies are available on a discretionary basis. That they are limited, of course. There isn't a a endless amount of money. So I would encourage all businesses to go to their respective district and borough website and see if they are eligible for that. And we try our very best to get money out as quickly as possible to businesses so that they can be sustained through this difficult period.
Thank you, Councillor Walker. And it goes without saying that I think the financial packages that have come forward from the government have been unprecedented in modern times in the support that businesses have been getting from the government. There is always going to be a debate as to whether they are, and it's enough, of course, but I do think if you look across the world, you will see that the financial packages that are on offer in this country for business are probably world class, if not top of the class. So while obviously one can always do better, and the districts and boroughs are of course doing their bit to support business, I think we need to reflect on how good the packages have been that have come forward to date. I thank you, Jonathan. Thank you, Lucy. Thank you, Richard. I've got Carly's hand up still. Carly, we've probably got time for one more because we're running near our end slot probably soon. So Carly.
Yeah, just a quick one for Lucy mainly, I think, if that's okay. There was quite a focus on the over 60s cases in the surveillance package this week. I just wanted to ask you if you've got any kind of insight as to why you think those numbers in that age group have increased at this time, and as a county, how can we counteract that and get those case numbers back down in that age group?
Thank you, Carly. Lucy.
So twofold, the reason at the moment for the over 60s. So in 2 of our boroughs and districts, we do have outbreaks in care homes. And obviously care home cases are included in the over 60s because typically, obviously those case numbers, the cases are sort of older age. But as I said, that's only in 2 boroughs and districts that it seems to be influencing the rate. The rest of the county is just purely community transmission. So whether that's within a household because people obviously live with older people, or whether it's because we're seeing bubble related activity because we've got a grandparent helping with sort of out of school childcare or whatever the case may be, it's that interaction that is still the lion's share of the driver across most boroughs and districts. And that's why our message really has been, we recognise that people will need to do that. We do understand that this is really challenging time. Not all childcare provision is open, and people still do, are having to, particularly key workers, go to work and cannot work from home and therefore do still rely on informal childcare. But if you have to have that sort of bubble and that interaction with somebody who's over 60 for those reasons, we would just ask that you really seriously consider who else you are then mixing with. So that, if you're going to maintain that contact, that you're minimising contact with people outside of that bubble, and who may pose a risk, not just necessarily to you, but to that older person that you are obviously using either for support or supporting yourself as a carer. I know these are difficult times, but these are people who are particularly vulnerable to the more severe symptoms of the disease, and obviously sadly who are much more likely to die. In fact, there was an NHS England call earlier, and I'll give you the exact quote. They've been looking at the risk profile for vaccination. And obviously we've got lots of clinically vulnerable groups because they have underlying conditions, but age is still the greatest factor of mortality as according to the absolute risk. And therefore age will dictate who gets the vaccination first, not an underlying condition. So you could have a younger person with an underlying condition, but an older person, even without an underlying condition, is still likely to be prioritised for vaccination first, because age is the greatest absolute risk for mortality with COVID. And therefore, the less risk you can pose, the less communication and contact you have with other people, if you are obviously in regular contact with somebody over 60, the better.
Thank you, that was really helpful.
Thank you, Carly. Thank you for your question. I'm just going to quickly cast my eye around the room to see if there's any other questions. There don't appear to be. in which case I think I will close today's press conference. As always, thank you everyone who's attended. Thank you to our friends from the press and everyone on the panel who answered the questions. Stay safe out there, stay well. And remember, we're still in lockdown till midnight on the 1st of December, after which we go into tier 2. So there's still a lot of work to be done by the people of Northamptonshire to get this virus down. We can, of course, go up a tier as well as down a tier, and that is something that we want to avoid at all costs. So it's really it's for all of us to work as hard as we can over the next few weeks to bring down the infection rate. Thank you very much. Have a great weekend. See you again next week. Thank you.